everyone. My name is Celeste Corvo. I want to welcome everybody tonight on behalf of the Milford Medical Regional and also Patient Family Advisory Council. So for those who don't know what Patient Family Advisory Council is, the Advisory Council acts as a resource to the medical center, and they partner with the medical center in order to provide suggestions for any quality improvement projects that we're doing at the medical center. It's to improve the patient experience, and so we're currently doing Conversation Ready here at the medical center, so we've partnered with them. And there are other quality improvement projects that we're also partnering with. So I would like to first thank our panelists for joining us. So our panelists will share life care moments that they've experienced having to do with healthcare proxy and end-of-life discussions. So I'd like to thank you for joining us. I'd also like to thank Dr. Tina Robakevich and also Dr. Anthony Wilson for guiding us and supporting us through the Conversation Ready journey that we've gone through. And basically what we're doing is we're reaching out to the public in order to share the information about Conversation Ready in order to make sure the public has healthcare proxies and has conversations with their family members. So thank you, and we'll continue with the panelists.
So my name is Ann Wilkins. I'm Director of Care Management here at the hospital. And tonight what we hope to bring you is education, experience, some stories, because we truly believe that we learn by stories. And we hope that when you leave tonight, you will be comfortable in having a conversation about what you want at the end of life. And that is whether you're 18 or you're 118, because none of us are guaranteed anything. So the talk is not just for the elderly, it is for everyone, because a crisis could happen at any point, as you'll hear in our stories tonight. A show of hands. How many people here have a proxy? Okay, good thing, because the rest of you are all in trouble. But by the time you leave tonight, we're going to show you how to stay out of trouble. Just very quickly and briefly, these names will sound familiar, I think, to a lot of you. Karen Ann Quinlan, Terry Shrivo, Nancy Cruzon. These are all people that the court continued to experience length of dwindling because there was no clear direction on what could or couldn't happen to people once they were in a state where they couldn't make their own decisions. So the one thing that we do know from all of those people is, when I looked back in the literature, that it tore families apart. Some of these people languished for 10, 11 years. So what the court finally said, and we do have an esteemed lawyer here to talk about that, but they finally said that the only way to get your wishes met is to properly document them. So that's what we're going to teach you here today, is we're going to teach you how to do it properly. Ask all the questions that you want, because we have a very esteemed panel tonight. We have Dr. Richard Daly. We have attorney Arthur Bergeron. We have Father Tom Landry. We have physician assistant Kim Morse, who is also on the palliative care team here at the hospital. We have Corine Minkle, who is a PFAC member. And we have Christa Branigan, who's a licensed independent clinical social worker here at the hospital. So let me not hold you up any further, because I realize that the first pitch is being thrown out at 8:09 tonight. So we want to get you out for that. So maybe we can start with you, Christa?
Okay, Ann.
All right.
Ann's my boss, so I do what she says to
That's
do
right.
first, so that's good. I'm a social worker here at the hospital, and I generally cover any floor, but typically the emergency room and the PCU up in the ICU. And I'm just going to talk about a couple stories that pertain to healthcare proxies in particular. I'm going to call my patient Tom. Tom was an otherwise healthy 36-year-old man who had not been to the doctors in 15 years because he was too healthy to go. You may have someone like that in your life, or you may not. He enjoyed being self-employed as a carpenter, and he spent every other weekend with his children. And one day, he was up on a roof, and he experienced tightness in his chest, and he ignored it, thinking it was indigestion. Upon returning home, he told his girlfriend about the pain, and she insisted that he come to the emergency department. And while in the emergency department, I met with him and told him we encourage everyone to do a healthcare proxy. And while it took a lot of convincing, I'll tell you, he said, "All right, I'll do it for my kids, Christa." I said, "Okay, I'll take it, Tom, that's good." So he did it. We filled out a healthcare proxy. And the next week, Tom came back. He was in the ICU, and he was intubated, and he had a massive heart attack. And his girlfriend, who was named as proxy, was able to help make the decisions for his health care while he was intubated. And I'm really happy to say that he made a full recovery, and that was a happy ending to that. And he did thank me for doing his health care proxy. And we often encounter patients who believe they're too young or too healthy to do a proxy. And I hate to say it, in all disclosure, I was one of them. When I started working here 4 years ago, I didn't have one. And about my third day of working here, my good friend Karen Evers, who was my fellow social worker, pulled one out of her desk, and she goes, "Who's your healthcare proxy, Christa?" And I said, "Oh, that's nice. I don't know, no one. Don't you have 2 children, Christa?" "Yeah." "Don't you have a husband, Christa?" And all that. And I go, "Yeah, I do, Karen." She goes, "Okay, here's a pen. Let's have a discussion." And we sat down and we really talked about the benefits of it, and there was no bad side of it. It was all benefits. And kind of needless to say, at the end of that day, I had a proxy signed, and I gave it to my PCP and my husband, and they have copies of it. And I talked to my sister and my husband and talked to them about why I chose them and what I wanted also after I made that decision. And the ironic thing was that Karen was young, and she had a proxy, and she named her brother as her proxy. And she actually ended up getting into an accident and was on life support, and it actually didn't make it, but her brother was her proxy, and it gave her young children, a lot of, it made them feel better knowing that he was making her decisions with them, and gave them a big peace of mind at the end that her wishes were followed. So I'm sure that decision made her tragic situation a little easier for the kids, because they knew the uncle would make the right decisions for her. So a healthcare proxy really is a gift to your family members. And it doesn't matter how old you are, but it really is a gift. And it's not only important to choose your healthcare proxy wisely, but also to tell them your wishes and values before, when you choose them. So I'm going to hand the microphone over to Corine.
Hi, I'm Corine Minkle, a member of the Patient Regional Family Advisory Committee here at Milford. This is Brad's story. It's my story. It's our story. A healthy male, employed homeowner, great shape, outdoorsman, and a man with many hobbies. Married, father, grandfather. Celebrated 36 years with the same woman. In his childhood, he had the typical childhood illnesses along with a few bumps and bruises. Late teens, a few more bumps and bruises and a broken nose. Early 20s, a few good hangovers. 1 migraine headache, wisdom teeth removed, and a broken heel from playing ice hockey. Midlife, 30s, 40s, and 50s. The usual minor aches and pains, typically of aging or growing up. Other than cutting off a piece of a finger in a woodcutter, he was healthy and up to date with his wellness physicals. At 50, a polyp-free colonoscopy. And then one beautiful Monday a.m., within minutes our lives changed forever. He was 54 and we found ourselves in the emergency room with stroke-like symptoms, but not really. He thought he was there for a small cut on his leg that he got on a motorcycle. Clearly, he was a bit confused, and at that moment, along with the doctors, we realized he was not capable of making any decisions. Within 30 minutes, he was diagnosed with a brain tumor, and in an hour, we were in an ambulance on our way to Boston. Hearing the words, "if he lives through the night," was enough to snap me into a reality I didn't want to be in, and I know he didn't. We just lost total control. Once in Boston, Brad had 3 seizures, partial paralysis, and definitely a personality change. Within 5 days, we'd hear the words cancer, stage 4, highly unusual, inoperable, which metastasized to his brain. His prognosis, 10 to 20 months, with an aggressive treatment plan made to order just for him. What followed were a boatload of highly unusual side effects. But he came home, gained his strength, and welcomed his second grandchild. He even rode his motorcycles again. Yes, we had our will, our healthcare proxy forms, but more importantly, we had all the conversations at a very young age. It didn't, however, make any decisions easier or change the inevitable, but at least we were somewhat prepared and sort of knew what to expect. Yes, we lost total controls and our lives as we knew it. We needed to make thoughtful, immediate decisions to address his healthcare plan, to address the brain tumor and cancer. Our goals were the same, and he trusted me to speak for him throughout the journey when he could not. However, most of the time he could. In our darkest hours, we never lost our sense of humor, stopped dancing in the kitchen, or wavered from the tough decisions we had to make. We both understood what mattered most and had conversations early and often with each other. Brad lived 19 months with his highly unusual cancer, and in the end, he died with dignity and respect in the comfort of our home just the way he wanted. We had a wonderful team of family, friends, and professional medical staff. How fortunate were we? I share his story and our story not to make you sad, but the hope that you may somewhat be prepared when the unexpected happens, knowing that you have a choice in what matters most at any age. Thank you. Kimberly.
I'm a lefty, so I'm going to move this to my left side. So I'm one of the palliative care physician assistants here at the hospital, and during my time practicing palliative medicine, I've come to learn that every attempt at a conversation regarding a person's wishes is valuable. I first met Mrs. X when she was in her early 50s and hospitalized for the 13th time due to her advanced lung disease. This was a result of prior decades of smoking, chronic obstructive pulmonary disease, and lung cancer. The latter had been successfully treated with chemotherapy, radiation, and surgery. When exploring what was most important to her, I learned about her daughter and grandchild, her beloved dog, and her supportive husband. I also learned that she was homebound and spent her time either in bed or on her couch, requiring around-the-clock oxygen and the use of a mask. Any little bit of activity caused her to become very breathless, talking, eating, toileting. This breathlessness escalated her anxiety, which she already felt paralyzed by. On numerous occasions and with several different providers, she immediately shut down conversations about electing a healthcare proxy, as well as anything that surrounded advanced care planning. My visits with her continued as often as she was admitted to the hospital. This was anywhere from 8 or more times each year, building a trusting and supportive relationship. At each visit, she would allow me just a little bit more exploration about how she was feeling physically, emotionally, in relation to this chronic, progressive, and ultimately terminal illness. She was interested in prolonging her life and voiced a terrific fear of the end of her life. She did not want to die. She was willing to accept help from social work, pastoral support, and psychotherapy to help assist with her anxiety surrounding having a chronic illness. After several visits and encouragement from not only myself, but also her family, she was willing to elect her husband as her primary and only healthcare proxy. Although she completed this document, she was still very hesitant to discuss her preferences of what she would want to happen if and when she became sicker. That was until she was evaluated for a lung transplant and felt not to be a candidate at all. It was at that time that she allowed me into her home, where she was most comfortable talking about what she may want as the end of her life approached. She remained interested in efforts to treat things that might be reversible and to try to keep her as healthy for as long as possible. This included allowing for short-term intubation. She had clearly voiced to me that should she require being on a ventilator and should she not be able to come off successfully, that she would want her husband to make the decision on her behalf to remove the life support, allowing her to receive medications for comfort and the crippling anxiety, so that she would not anticipate dying, but yet have a peaceful and comfortable death when and if that time came. Her healthcare proxy supported these wishes, and several months later, unfortunately, she was again hospitalized due to an acute illness. Despite our aggressive attempts to treat respiratory failure and infection, she worsened. Her wishes for intubation were followed, and when her condition did not improve, despite the effort, her spouse followed her exact care plan that she had shared with us, with him, and her daughter. She died comfortably, surrounded by her family, just the way she would have envisioned. I see these patients many times here in the hospital, and sometimes that first conversation is not successful, but it doesn't mean it should be the last conversation. Thank you.
Good evening. My name's Dr. Richard Daly, and I don't mean to brag too much, but I have a wonderful job. I'm a family physician, so I get to treat patients of all ages. Yesterday morning, I had a 93-year-old woman for a checkup, and this morning I had a 6-month-old little boy for a visit as well. As a family doctor, I get to treat the whole family. So I get to spend time with children and their parents, and I have seen firsthand what families go through when an elderly relative becomes ill. And I have seen what happens when the children are caught in the middle and they don't know what to do and they don't know who the primary decision maker is supposed to be. And I would share with you one of the cases that I did not personally treat, but to me is the quintessential example of why a healthcare proxy is needed. There was a young woman who was 26 years old and had been married for 3 years, and she suffered a cardiac arrest as a complication from an eating disorder. She collapsed at home. Paramedics were called. They rushed her to the hospital. They were able to bring her back to life to resuscitate her, but she was effectively brain dead. She was kept in a rehab facility for almost 8 years, in which they had tried to do everything and anything they could to see if they could get any level of function back. After 8 years, her husband felt that she would not want to live like this any longer. And so he petitioned to have her feeding tube removed and to let her die. Her parents opposed this, and they engaged in a legal battle that took an additional 7 years. Eventually, he won the case, and the feeding tube was removed, and she passed away. She was kept alive for 15 years in a brain-dead condition. And to me, that is the quintessential example, and I think I can understand both sides of the case and why family members would feel one way. But if that patient had had some kind of directive or plan outlining who would make the decision, I think 15 years of difficulty could have perhaps been avoided. That's the Terry Schiavo case, for those of you who are unaware. Now, this case is incredibly unfortunate, and I think it shows an example of why does a young person have to have a healthcare proxy? And some of you may say, well, Dr. Daly, I don't have an eating disorder, and nothing like that is ever going to happen to me. But in my training, I got to spend time at a rehab hospital for individuals who had suffered brain injuries. 3 million to 5 million people in the United States are suffering with the sequelae of brain injuries. These are people who may have fallen off a bicycle, been involved in a motor vehicle accident, and their bodies are fine, but their brains are damaged. And again, with no healthcare proxy in place, who will make their decisions if they're incompetent becomes very difficult. Another issue that I would call your attention to for young people these days is the terrible issue we're going through with the opioid epidemic. We lose 140 people every day in this country to opioid overdoses. Those are fatal opioid overdoses. So you can imagine if there are 140 people dying every day from an opioid overdose, there are an even larger number who are suffering non-fatal overdoses, where they stop breathing for a period of time and we resuscitate them. If any of you want to guess how long it takes for your brain to be damaged when you stop breathing, it's only 5 to 6 minutes. So many of these patients suffering these overdoses are going to suffer brain damage. And if they're incompetent, who's going to make those decisions for them? So I think it's just another example of why young people need to have these healthcare proxies in place. The final issue I'd point out to you, I don't know if any of you are parents, but if you ever try to call a doctor's office for your 19-year-old and ask questions, you'll often get a response that, sorry, can't talk to you. Now, a healthcare proxy is not going to fix that, but it's one step in case anything more serious were to happen to have that in place. So with that, I'll finish my remarks. Thank you for your attention.
I'm Father Tom Landry. I'm the pastor of St. Peter Parish in Northbridge, and I work as one of the chaplains here at Milford Regional Medical Center. In another life, I was 10 years as a full-time chaplain at UMass Memorial Medical Center in Worcester. I'm going to give you 3 quick snippets. Don't push your luck. That's my godmother. Through all of the time I can remember being alive with her until she died in her late 80s, that was her byline. She and my godfather never had children of their own, so they were very close to us, who were her godchildren. And even though they moved in retirement to Florida, we still remained very close. And none of us really brought up these issues with her. Well, actually, I'm going to take that back. I did bring it up once. Don't push your luck. So we didn't have that conversation again until after Uncle Ralph passed away. And then it was just she. And so I asked her, you know, now that Uncle Ralph's not going to be here, do you have a will? Well, of course. Good. Do you have a health care proxy? What do I need that for? Well, the will is going to help us take care of things after you die. What we would like is to have something to help us take care of you while you're alive, if that's okay with you. Of course, you did things like that with her with kind of a sense of humor. It helped. So that didn't create the solution on that first visit, that first conversation, but it brought us to a time and further conversations when we could talk about how important this would be for her and how important it would be to us. And that's when her eyes misted, when she heard how important it would be to us, who wanted to ensure that she would be cared for in a way that she would want, in a way that we would all feel better about. So she gave it more thought, and then eventually she called me and she says, well, I've done 3 things. Okay. I updated the will because he's dead. Okay. I appointed an executor with durable power of attorney. Okay. And I signed a health care proxy. Well, good. And they were 3 different people. That's okay. You know, we all got along. It made it easy because we each had an area of responsibility. And she had wisdom. She picked the right people for each of those 3 things. She picked the goddaughter who was best positioned to be her healthcare agent and assigned her proxy to her. It's about relationship and trust and about health and physical issues. She trusted Adele most of all. And that was a gift to everybody. Okay, so 2 other snippets. One is at the hospital in my role as a chaplain, and one is in the parish as my role as a parish priest. In the hospital, I met a patient. Somebody had brought up the idea of possibly having a healthcare proxy, and this patient felt paralyzed in that regard because there was no spouse, there was no surviving parent, there were no siblings. There didn't seem to be the obvious person to choose because of what this person thought about who a healthcare agent should be. I said, well, okay, who's in your life? You've just described to me who's not in your life. Who is? Oh, well, blah, 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 blah. So there were people. There were people. So then we started talking about the people who really knew him, and whittled it down to the people who really knew him such that he could trust them about these very personal, almost intimate realities. And so he was able to come to a conclusion. And then finally, a woman who was a patient in the hospital who was pretty sure about picking this individual to be the healthcare agent, but didn't know how to talk with that person about what was important to her. And there are a number of tools that are available that we can put in the hands of a patient, that we can put in the hands of a prospective or even existing healthcare agent to say, okay, these are things that are likely going to become questions if there is a situation in which you find yourself in a diminished capacity. Focus on the ones that are important to you. And then have the conversation about those things. Either write out what those wishes are so that they have them in their hands when they need to make a decision, or if you feel like that's going to paralyze them or limit them in ways you don't want to limit them, if you've discussed what those are, that person will be really well prepared to hear the questions that the doctor's going to ask in any given situation and have a good chance of giving the answer you would give, but that you can't give right now. So don't push your luck. That's the first point. Second point is, well, who is in your life? Most deeply, most knowledgeably, most trustworthy. And how much can you help that person be prepared to help you?
Wow. So my name is Arthur Bergeron. I do nothing but elder law because I'm in a firm of 70 lawyers, so everybody gets to kind of specialize. I have no clients under age 55. My median client age is 74, so all my stories are old people's stories. When we were talking kind of in the prep for this, they said, oh, it's good to be a lawyer because there are always legal trivia questions. So I thought maybe I'd just start with some trivia answers and then go to the story. First of all, no one can make a healthcare decision for you. No one can make a healthcare decision for you, right? Unless you have a guardian. And if you're, that guardian has to be appointed by the court, or if it's a child under age 18, then the court presumes that you're the guardian. But that's it. No one otherwise can make a healthcare decision for you unless you've signed a healthcare proxy. So, by the way, I know one of the mentions was of young people in these cases. I know that there's a program running in Westboro right now. One of the selectmen is leading a program with the principal of the high school to get every high school senior to do the proxy, because they're all turning 18 and they're leaving for college. And if they go to college and they have a problem, no one can talk to them, no one can speak to their problem. No one can answer their, no one can solve the problem. The folks can call from the university, oh my God, there was an accident. But that kind of ends it in terms of they can't do anything, okay? So the proxy is really, really important. Second, I had a little list, and now I can't read my handwriting. This is really not good. That's not a good sign. You can only have one proxy at a time in your proxy. You can't name multiple people. Why is that? Because Dr. Daly here does not want to know that you're sick and now two of his kids or your kids are arguing about what to do with you, right? He wants to only have to talk to one person. So you can only name one person at a time. Third, every time you sign a healthcare proxy, you have thereby revoked all previous healthcare proxies. So if you've done a healthcare proxy, you've got the right people, and you've got your daughter and then your son and blah, 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 and then you have an emergency, and you come here to the emergency room, and they say, well, we're not even want to admit you until you've signed a healthcare proxy until there's if there's a problem here. So they pull out one of their forms, and you sign one of those proxies, and maybe your son or daughter aren't around, and so you name somebody else as the immediate proxy. What you just did is you invalidated your previous healthcare proxy, so you should just be aware of that. Your proxy, the person that you've given the healthcare proxy to, trumps any decisions you may have otherwise made through a DNR, through a so-called Morse form of medical orders for life-sustaining treatment. If you've made any of those instructions regarding how you want to be treated or not treated in the event of an emergency, but you've also named a proxy, and that proxy's around and decides that they disagree with the decision that's on your Morse form, they can overrule it. Proxy has total power. The proxy only takes effect once a doctor has said that you're incapable of making a medical decision. When that doctor says that, the only effect of that is that your proxy then has the ability to make a medical decision. It doesn't mean that you're incompetent to make other decisions. It doesn't mean you can't sign a power of attorney. It doesn't mean you can't sign a new will. It only means that you can't make a medical decision and your caregiver is going to take that or make that decision for you. Here's a piece of trivia. When you die, your proxy has the right to give away your body. Who knew? They actually have the ongoing power as opposed to powers of attorney that die at death. The proxy retains the power to give your body to the New England Organ Bank or to give any of the pieces to the New England Organ Bank. So if you don't want it given away, you should talk to your proxy about that. Finally, living wills are not legally enforceable in Massachusetts. Living wills are not legally enforceable in Massachusetts. That includes the 5 wishes forms or any other forms that may look like that they're somehow binding in terms of what you're saying in those forms, but they're not. And so the moral of the story is, in addition to signing many of you have signed a healthcare proxy form, right? So how many people here have written down a document that describes to the proxy how you want to be treated? Want to raise your hand? Oh yeah, about 2, right? So that leads to, I deal with this a lot because I got a ton of people who've got Alzheimer's, who've got dementia, and who therefore, we're not worried about, this isn't life or death. This is people living for a year, 2 years, right? Don't have the ability to make a medical decision. So somebody's got to make all those decisions for them, right? Who's going to do it? The proxy, unless there's no proxy, of course, in which case there's really a problem, right? I guess the final story is just this story that I remember of a good friend of mine. His brother is now the mayor up in Marlborough, and he worked in the tree department until he fell out of a tree. And was hospitalized for 6 years, and was really not able to make any decisions. But he was a young guy, so of course he didn't have a healthcare proxy, right? Which meant that a guardian had to be appointed through the probate court, and it meant that imagine how many medical decisions had to be made on that kid's behalf for 6 years, and the person making the decisions had no idea what that person thought were really important things. Imagine the time that he got sick. He had pneumonia and he went to the hospital. Did he really want to go to the hospital? Would he have really wanted to go to the hospital and get better, recover from the sickness, and be back to being where he was, for another couple of years? But he had never given anybody the power to make those kinds of decisions, and he had never talked to anybody about them, right? Thank you.
The thing that I do want to reiterate and make clear is, if you don't have a healthcare proxy, as he said, no one can make those decisions for you. And I think people think, my wife can make those decisions because I'm married. No, they can't. My children can make those decisions because they're my children. No, they can't. What will happen is the state will appoint an attorney and they'll decide what your wishes are. So we really want to drive this home. We don't mean to scare you, but we also have worked in this field long enough to know that I don't want you to assume that just because your loved one loves you, that they can make decisions for you, that it has to be a healthcare proxy.
So after listening to all these panelists, you can see why the Conversation Ready project is a project that's so important to get out to the public. It's a campaign that we're trying to do. The Institute of Health Improvement, we've been working with them. Milford Regional Medical Center is a pioneer for this project, and so that's why we're having discussions such as these. So basically the question is, do you have a healthcare proxy, and have you had conversations with your family member? And if not, it's time to have that conversation. So this is the healthcare proxy form. It sounds like most of you have a healthcare proxy. In your folders, you'll find the healthcare proxy form, and you'll also find some helpful guides that will lead you through the process of choosing a healthcare proxy agent, and also having that conversation of what matters most. So there's your 2 kits and the healthcare proxy. So how to choose a healthcare proxy? A lot of the panelists already spoke of it. You want to make sure that you're choosing somebody to make they basically tell you what their wishes are, and that you respect their wishes. And this is basically if you're unable to make these decisions for yourself. And then it has the definition of a healthcare proxy. The person you choose to make the healthcare decisions for you if you're too sick to make them for yourself. So when should you fill out a healthcare proxy? Again, early, when you come of age at age 18 or 21. Often, it's good to review your healthcare proxy every decade. So in your 20s, 30s, 40s, and so on. And at any major life event, when you go to college, when you get married or divorced, when you have children, when you become eligible for Medicare, when you're going on a major trip, or when you're newly diagnosed with a serious illness. And it's always, their motto is, it's always too soon until it's too late. So who should you choose for a healthcare proxy? You want to make sure it's someone that you can trust to speak for you in case you are unable. Will the person make decisions that are in line with your wishes, or do they have beliefs that they will then take over and they'll do what they want instead of what you want? The proxy is the person who makes decisions for you when you're unable to speak, so they have to be comfortable speaking up for you. So if it's a busy physician that's coming in and you have questions to ask, but you're not comfortable speaking up, you have to be comfortable. So when you're choosing a healthcare proxy, it's important to choose somebody who's confident, who's able to speak up, and basically let your wishes be known. And who should prepare, how should you prepare your proxy? Make sure you've asked your proxy to take on this role. There's many times that it happens where it becomes a surprise. The proxy will get a phone call in the middle of the night during the day, and they'll say, you're on this form, you are the proxy, and they never even knew, and they don't know what your wishes are. So make sure that proxy understands his or her responsibilities. So have that conversation with the proxy. Let them know what their responsibilities are if that time comes where they'll have to make the choice, your choices, your wishes. And what is the most important thing you want the proxy to keep in mind. So these are the things that you're communicating with them. So as I said, the guide gives a step-by-step process. It gives questions that you can go through, and then afterwards, once you do those questions, then it summarizes what your answers, and these are the things that you want to have the conversation with your proxy.
So now this is questions?
Way up back.
Sir, in the back?
Actually, two. Maybe one for Corine. Corine, I've seen healthcare proxies that don't have mass healthcare proxy on it. If it is completed and it says healthcare proxy, is it legal in the state of Massachusetts?
It's legal if two witnesses have signed it. Right, but it doesn't have to be notarized, none of that jazz.
Okay. All right. Second question, which is really a
And but by the way, foreign healthcare proxies aren't, there's an issue about this, aren't,
the what?
the foreign healthcare proxies don't necessarily cross borders, you know, so that if you got one that says New Jersey,
Sure.
you don't want
Yeah.
to bring it into this hospital because they're all going to be like, I don't know.
Sure. Next question is a two-parter, and I'm not sure if this should go to Dr. Daly or not, so I'll just throw it out there. If I'm a member of my primary care physician is in the Milford Regional Physician Group, and I give that physician my healthcare proxy, will the hospital be able to see it if I go to the hospital in an emergency?
Dr. Robakevich, can you shed any light on that? I believe there is a system called the Highland system that allows some transfers. I don't know, Tina, if you know much more about that.
So unfortunately, in this day and age, with all the different electronic healthcare systems, there's never been a mandate that they be able to communicate with one another. And that has created significant problems when it comes to having important forms like the healthcare proxy available. We've been trying to do workarounds in our system, and so our IT people have created a means so that when there's a form that's entered in the primary care system, there's a notification in our hospital system that something exists. But then we, as the healthcare providers, need to actually go out into the outpatient system and try to retrieve that. So it's actually best to make sure that a copy has been provided to all of the important physicians who care for you at their offices, and also a healthcare proxy form has been brought and scanned into the hospital system. We encourage not only you as the patient to have your healthcare proxy document, but encourage you to also make sure that your healthcare agent or other key family members also have copies, so that if for some reason we're not able to retrieve, there's a copy and we can honor the form.
You're a good lead person because you answered part of my second part of my second question. How do I get a healthcare proxy into the hospital system?
So if you have been a patient here at the hospital, then you have an assigned medical record number. And so through the medical record department, you can bring a copy to have it scanned into the system. We have challenges for individuals who live in our community who have never been patients at the hospital because there's no number identified with them. But if you've been a patient at some point within the hospital system, then you can have a copy scanned into the system.
I would also add that at the Milford Regional Physician Group, we clearly can see your healthcare proxy. If it's in our system, we can call it up with a click and we can print it out with a click. We also can record the MOLST forms that you've heard about as well. So in our setting, we can get them in the outpatient world. Also, anyone who's a participating Milford Regional physician, some of our specialists are also on that same record and can see your healthcare proxy as well there. We're just working out the communication between the hospital. We are going to be going to a new electronic medical record in the future, and I think the system will improve over the next, 2 years or so.
By the way, for what it's worth, I was on the board of one of the hospitals connected to the UMass system. Same problem. Unless you're coming in as a patient, there isn't an electronic way for you to just show up and say, in case of an emergency, I'd like to have this on record. They can't do it. Gigantic system, and they can't do that.
And when all else fails, Milford Regional takes healthcare proxies very seriously. We will go hunt them down. We will call the physicians' offices. So we really take that very seriously.
Isn't that a question that's asked of every patient coming in? Do you have one?
Yes.
Yes.
If you do,
Multiple
produce
times
it?
sometimes.
Yes.
Yeah, on the floor or something, yeah.
Andra?
I have a question. I'm a little confused between the healthcare proxy and the Most plan, and I've heard that one wipes out the other, and I thought in my mind they work together. Can someone define that better for me?
Well, I can discuss the MOLST form is a very specific form that clearly asks you specific questions. Do you want to be intubated? Would you want dialysis? Would you want artificial nutrition? It's very specific. And you go through that and you have different options for what you want to check, and then you sign it. And that becomes part of your medical record. I'm learning tonight from Mr. Bergeron that the healthcare proxy in some ways supersedes that, because the healthcare proxy, if it's invoked, can then make the decisions for you. I think, in my opinion, the MOLST form is extremely helpful because your proxy then has something to refer to, and it even, because you may have conversations with your family, but did you have a conversation about, do I want dialysis? Did I have a conversation, do I want IV fluids? So I feel that the MOLST form is very, very helpful, and I'm a strong proponent of it.
Can I just add to that?
Sure.
So with the MOLST form, it is a medical order. It needs to be signed not only by you as a patient, but also a medical provider, either a physician, a nurse practitioner, a physician assistant, and it outlines what you would want in certain circumstances. Should you develop a cardiac arrest or respiratory failure, or have a stroke and need artificial nutrition. It's very specific about certain things that you may or may not want in the future if you were to become sick, either acutely or chronically. But what's important about that is it is a medical order, so physicians have to follow your outlined wishes if the healthcare proxy is not invoked. Does that make sense?
What does it stand for?
Medical Orders for Life-Sustaining Treatment, MOLST. So I think, following up on what Kimberly said, so as a legal matter, the significance of the MOLST is actually not your signature, it's the doctor's signature, because it is a medical order. So it's basically an order from the person at the top of the medical food chain to everybody else, to the nurses, to the EMT that might show up at your house, that basically overrides what the normal protocol would be in some of these cases, which is do whatever you can to save them, right? And basically what the MOLST form is the doctor's order with your assent that says, well, in some cases, don't, right? Now, the form itself actually says that it can be signed by you or by your proxy, And your proxy, and you have the ability at any point to rip it up, right? And to say, I don't want that anymore. And so does your proxy. If the doctor has said that you can't make a medical decision, at that point, the proxy takes over, and the proxy can override the MOLST form. I'm going to give you one piece of trivia, though, that by the way, that I learned. So here's the situation, right? So you're on the floor next to the refrigerator. The EMT shows up, and on the refrigerator is your MOLST form, and it says, don't revive me. But your husband, who is your proxy, is right next to you, right? And he says, no, you got to revive her, you got to revive her. So what's the EMT going to do? No, the EMT is supposed to say, because the healthcare proxy hasn't been invoked yet, The doctor hasn't declared that you're incompetent to make a medical decision, so the proxy can't make the decision. The EMT is supposed to follow the Morse at that point and let you die. That's trivia.
The proxy is supposed to follow your wishes that you have outlined. So you're
That's right.
choosing that proxy to follow the wishes that you would make if you could be making them at that time.
Right. Which is why, as you said, it's so important to talk to your proxy about what you want, so that they're not guessing.
And there's one more thing that I want to point out. If a physician feels as though your proxy is not acting in your best interest, we will break it here at Milford Hospital. So it's not, I just don't want you to think that I say I do not want to be resuscitated, and the proxy comes in and says, you know what? I know that that's what she said, but I want her resuscitated. If your physician has had that proxy, the healthcare proxy, and sees your wishes, we can ask that that proxy be broken. So I don't want you to have the fear to think, I mean, the reason why you're having the conversation and you're setting somebody up to be your proxy is to carry out your wishes, not their wishes. So I just wanted to make that clear, that we will break it, and we have broken it.
About that, who would have the power to say that that was okay, legally speaking?
The physician, if the physician
can,
sees,
without any other
it's
oversight?
in medical best interest, okay? You know, I mean, but if we have had situations, and they're few and far between. I've been here 20 years, I can name two. But that the healthcare proxy has directly gone against the wishes of the person, of the patient. And the physician knows that.
And is that legal though, if the family were to challenge the hospital making a decision like that?
What we would do is send it into court, and now we need a guardian. It's not like we let the patient languish. But it's a rare situation. But I want
But there is a legal,
Yeah.
method for
Because the only people that can make that decision is a healthcare proxy or a guardian. So if the healthcare proxy is not making the decision, somebody has to make the decision, but then the court steps in. It's a rare thing, and it's usually the physician that sends up the red flag that says, let's have a meeting on this, because they're going against what is medically best for the patient.
And if the family were to be in a similar situation where an acting healthcare proxy was perhaps not following what the individual's wishes were, the family could then also use the court system to try and challenge the healthcare proxy? Maybe it's
I mean, I leave that but in the situations here, what we have had to do next is say, but to petition, to get a lawyer for the legal, not guardian, what's the word I want? Guardian ad litem. For a patient to talk to all parties involved, and then to make a decision with the judge.
But the key to that all is, if the healthcare proxy is clearly aligned with, first, that relates to two things. First, you got to pick the right person.
Right.
You have to pick the person. I mean, a lot of people will not name their spouse because he won't let me die. He won't let me die. Or the daughter that's very strict religious beliefs, and you've got to say we got to save her at all costs. You really need to pick the right person, and then you need to talk to him. This notion of I've heard those stories. People getting called in the middle of the night. I'm the proxy. What? That's why in our firm we require at the back of the proxy we have an acceptance page to be signed by both. And is that required legally? No. But we want to make sure that the person who is named as the proxy knows they're the proxy. Right? It's just really important. And then you give them some instructions.
I have a question. I have a proxy here at Milford Hospital. If something happened to me and I had to be transferred to Brigham, does that proxy go to Brigham? Does that follow me?
They should send a copy of that.
They would.
If you were here at the hospital and being transitioned to a tertiary care center, yes, they should send a copy of the proxy with you.
It would be included with all of the paperwork documentation that summarizes the care that you've received in the hospital and all of the important documents. They go with you if you're transitioned to a tertiary care center.
Okay, so if I was, say I went to Brigham, and they always ask, because I've been through this, my husband was at every hospital, and they always ask the same question, do you have a health proxy? It seems as though we signed one every place we went, and the nurses would come in and witness it. So say I went to Brigham and I have the proxy here, will Brigham get the proxy?
Is it,
Or if I went anywhere else?
my question is, are you talking about if you were transferred from here?
No.
Or if you went there on your own?
Say it was an accident, and I ended up at Brigham or Towson.
Okay, so that's not going to be the case.
That's a different.
No, but
What would happen
the
then?
hospital can reach out and contact us
Yeah.
to obtain a copy with the appropriate signed release. It takes more time in doing that.
Okay, yeah.
And sometimes if you are alert and able to designate a healthcare proxy, at that moment when you're at another hospital, it's most efficient for them to have you just sign a new one
Well,
right
that's
there
what I
and
have
then.
done. I have done it a few times in the past with my husband. I've signed, he's, signed more, and I have been his proxy. And it's
We
been.
have some people that just literally bring a binder with them with their
Yeah.
medications
Yeah.
and a copy of their proxy.
Well,
It's
now,
just-
now
yeah.
you do, but when, sometimes
Yeah.
you're just there, and
I know.
I've had them say, does he have a proxy? And then we have to talk to him.
You're right, you're absolutely
I've
right.
also known individuals now with the smartphones that we have who have pictures of their important documents on their cell phone, so that then they can present it wherever they are.
If you're good at it, yeah. Thank you.
My last, what?
But your phone was passworded. And no one knew the password, so it kind of backfired.
If you choose a healthcare proxy, and for some reason that person isn't there to sign, you need their signature as well, right? To make it valid? No?
No, it's valid without the acceptances.
Okay.
That's why you have these middle of the night things happen.
Okay.
Because you've got these valid proxies, except the person doesn't know.
They actually can't be a witness.
Mhm.
They can't be one of the signatures in your proxy.
That's
Okay.
correct.
Yeah.
I have another legal question. I work with adults with cognitive and intellectual disabilities, so sometimes there's guardianship in place and sometimes not. Most of the time they've had the guardianship, but in some cases they haven't. And then the question of if they do need one comes into the situation, and they might have already had a healthcare proxy. Was it correct that if guardianship exists and it's new, that would trump healthcare proxy?
Yeah, correct. Well, the guardian, let me put it this way. The guardian has the right on behalf of the ward to revoke the healthcare proxy.
Okay, that was my other question, was in some cases, I've had guardians who didn't want to be making medical decisions, and so they signed a healthcare proxy.
And they can, and the guardian can sign the proxy on behalf of the person. That's right.
Okay, so
That's
that
right.
would, so in some cases you might have a guardian and a healthcare proxy?
Yes.
Okay, and, all right, great, thank you.
Can you clarify just so I understand what was just said?
So if a person has been found to be so incapable of making his decisions that a guardian has been appointed, right, and that person had already executed a healthcare proxy, then the guardian, just like the individual before he was declared to be incompetent, can revoke that healthcare proxy. Similarly, once the guardian's been appointed, the guardian could also name a healthcare proxy on behalf of that person, because the guardian has the ability to do anything that that person can make, to make any decision on behalf of that person, right?
Thank you.
Unless that power was limited, that you can actually, it used to be that you get these general guardianships and the guardian could just do anything. The new guardianships, as a result of some changes to the law, tend to be more specific in terms of the kinds of powers that they're exercising or that they can't exercise. So the judge could actually exclude that from their powers. But in general, a guardian could sign a healthcare proxy or revoke one on behalf of the ward. Okay.
Excuse me, I have a question on that. If you make out a healthcare proxy, I'm fine, I'm healthy, I'm in my right mind, I've made out a healthcare proxy, and I'm in an accident, and now I have brain damage, and I need a guardian. The healthcare proxy that I did, Mr. Bergeron, when I was healthy, can be...
It's still valid until that guardian gets appointed. That proxy remains valid. Because now you're not capable of revoking it.
But I was. So that's my question. I was capable of picking a healthcare proxy.
Right.
So how...
But right now, you're not capable of revoking it. So the healthcare proxy is still in effect until the guardian gets appointed. And then the guardian could revoke the healthcare proxy.
But wouldn't necessarily.
But wouldn't necessarily.
Okay.
But wouldn't necessarily.
Okay,
That's right.
That was, okay.
That's right. That's right.
I would just throw out a plug for the Conversation Project, which they sort of highlighted in the video. I think it's the best tool, if you have a family member that you're trying to have this discussion with, I think it's an excellent tool and workbook to sort of go through some of these difficult questions. So I just wanted to make sure everyone was aware of that Conversation Project. You can get it online, you can download the package to go through, but I think it's very, very helpful.
It's a great, great project, and it's something, once again, where Milford has actually been is one of the real leaders. I mean, Milford in general is one of the real leaders. One of the, if you live here, you don't realize how special Milford is considered to be by everybody else. There's just this remarkable standalone hospital. So just and kind of cutting edge in a whole bunch of ways. But I think in this way, it's really special. The notion of getting people beyond just the healthcare proxy conversation and getting them to have the real conversation about, so how do what is so important to me about my life that if I didn't have it, I wouldn't want to be here? You know, what is that? You know, to be able to have that kind of conversation, and if I can't be making decisions over a prolonged period, how do I want to be treated? Those are really important. And to be figuring out a way to have that conversation. By the way, I have a good friend who's a geriatric care manager. What she pushes is, have the conversation at Thanksgiving. Now I know you say, how can we be doing this at Thanksgiving? We want to watch the football game, and you know it has to be. But with today's families, that's like the only time people get together, right? People are flying in from here and there, and everybody's there, you know. And so have a couple glasses of wine, and then have the conversation. Just as a thought.
It'll be easier than talking politics.
Yeah, beats politics. That's right. It used to be that politics was easier, but not anymore.
And one of the other things I want to mention too is so when you have those, don't have those conversations, and when you end up being the healthcare proxy that then has to make those decisions, and you're not aware of what somebody's wishes would have been, and then you've made choices on their behalf, but you are left with, you know, once they pass, you are left with this complicated grief that, did I do the right thing? Should I have done this? And so that's why it's important. So, I mean, everybody grieves after somebody passes, but it ends up becoming so much more complicated when you're questioning yourself after, did I do the right thing? Did I make the right choice? So when you have those conversations with them, you know you've made the right choices.
I just, sorry to keep talking, but I just had one more thing I wanted to mention. I think there's 3 important documents that you want to have. So a will, healthcare proxy, and then I think power of attorney is an extremely important thing as well. I've had to fill out forms for patients after they get Alzheimer's regarding bank accounts and who's going to turn off the electric bill and all that stuff. And I just think that's a very important issue. So I hope we take a minute to think about that document.
And I would just add, the will is of the 3 of them to you. The will is the least important. The will only happens after you're dead. Why do you care? Right? The important documents are the healthcare proxy and the power of attorney. People are always coming in to me saying, oh, I really need a will. Well, maybe you don't, you know, depending on how your assets are structured and you own things jointly with other people. You may not need the will. But the power of attorney and the healthcare proxy, you have a stroke. You're just stuck. It could be for years. You're just stuck. And nobody can go and sign, you know, do your checks at the bank or talk to the insurance company because you don't have and nobody can make your medical decisions without going through this stupid probate process. Takes forever, costs you about $10,000. It's awful. And you can avoid the whole thing by just having those 2 documents. Forget the will.
What's the minimum
Use the
age?
money you were going to use for the will and do the healthcare proxy and the power of attorney.
What is the minimum age for a power of attorney?
For a power of attorney, either one would be 18. Healthcare proxy also, it's 18. Because before that, your parents are making the decisions for you, right?
Sir, you have a question?
Okay, the healthcare proxy kicks in once the physician decides that the individual can no longer make medical decisions for himself or herself. Is there a specific formula for arriving at that decision? what does a physician look for to?
I think that's a very difficult question, but I think you'd be looking for, significantly impaired mental function, inability, disoriented, doesn't know the time, the date, the location. You can do testing on a patient to sort of see how significant that mental deterioration is. I don't think it's a label any physician would want to put on someone lightly, and I think you'd want to have pretty significant evidence that it's there. Oftentimes, family members would approach me and say, "I think we need to invoke mom's healthcare proxy," and we would look for some significant proof as to why. But I think those would be the major issues. If a patient,
because with the term that we use in the medical field for helping a physician or any other provider determine whether or not a healthcare proxy is active or should the healthcare proxy be invoked, is we determine whether or not a patient or a person has capacity. What that word capacity is are they able to understand what's happening to them? Are they able to deliberate about their wishes for or against an intervention? And is that deliberation consistent with what they have said in the past? Or has it suddenly changed? If it's suddenly changed, why has it changed? Has their religious beliefs changed? Has something else changed, and can they explain that to you? If someone doesn't know why they're in the hospital or why they have a certain medical problem, if someone can't debate with you the pros and the cons of having a certain procedure or intervention done, and if everything that's happening, if they're saying something but they are totally inconsistent with what they've always said all along, all their life, and now there's something else coming up and they can't explain why everything's completely different from what they've said in the past, then we would need to deem that person without capacity to make decisions. So it's their decision-making ability, and often we get two different people to determine independently whether or not that person has capacity for decision-making.
So could I just add one thing, which is, if you want to revoke your healthcare proxy, for purposes of the proxy statute, you're always presumed competent. You can revoke your proxy at any time. So I give the example. So you're in the room, and there's your daughter who is the proxy, and there's the doctor, and the doctor has said you can't make a medical decision, and the doctor says, "So do you want to do the operation?" And your daughter says, "Nah," and you say, "Yes, I want the operation," and the doctor says, "Well, we invoke the medical proxy," and you say, "She's fired." She's fired. So now can't do the operation. Now there has to be a guardian appointed, right? You can always fire your proxy.
So if I could add one more thing to that too, because even though making a medical decision that's very complex, major surgery or whatever it is, those things are sometimes really complex decisions. The decision of who you trust to make a decision for you to make healthcare related decisions is a much, much, much lower bar.
Right.
And somebody who's even demented, they might not even know what day it is or what year or what month it is, but they can tell you who they trust to make decisions for them that would make the decisions that they would want, and who they absolutely don't trust to make decisions for them. So all they have to do is say no, and that yes to a healthcare proxy or no to a healthcare proxy, and that can revoke your healthcare proxy, and it's totally a different type of capacity than the capacity to make a very complicated medical decision.
Right.
That makes sense.
Right. Yeah.
I just had one more thing. Real quick story. My sister was 55 years old, went into respiratory distress, and died in January. But we knew what her wishes were. We were all clear on that. and we're hospice nurses, so we've had these conversations with our families. And my nephew was 28 years old, and he was a healthcare proxy, and people kept saying, Ricky needs to decide if she should be intubated, and Ricky needs to decide when we stop the intubation. And I kept saying, Kathy decided. She decided. So we made an executive decision, short term, that we would intubate her for a couple of days to see if her lungs improved. And when that became evident that that was not going to happen, and her baseline was, can I hold my grandchildren? Can I talk to my grandchildren? That's what she wanted. So we said no feeding tube, and then we stopped the intubation. But people kept saying, Ricky's deciding to take the, to stop the life support. But I had to keep saying, no, he's not making that decision. I didn't want him to feel that the legacy was that he stopped, and should I have kept it going? And, for the rest of his life, he was going to be tortured by this. And so just knowing that it's a gift, somebody on the panel said it's a gift. It truly is a gift to the family to know what you want, and have somebody that can be strong enough to advocate for you when it's really tough. When you got a bunch of neurologists on one side of the table saying she might go to rehab and she might get better, and all of those things. So it's really important to
I think that's the core, is what would the patient want? And the healthcare agent should always be, it's not what you want as the agent, it's what do you think the patient would want. And I think that takes a lot of the guilt and pressure off them, which is a huge issue, and I'm really glad you brought that up.
Now, Mr. Bergeron, you had said that living wills weren't legal in Massachusetts.
They're not legally enforceable. So nothing you put into your living will regarding instructions regarding how you want to be treated is legally enforceable. It's great as advice. That's one of the things why we were all promoting writing something down so that your proxy, right, can really have a sense of what is really important to you. I just want you just want to understand that you want to be able to trust your proxy, though, because ultimately it's your proxy that's going to decide regarding any of those matters. Okay?
So would you recommend a trust instead of a will?
Trust doesn't do anything for you in these cases, right? These are all questions regarding what are your medical decisions going to be. The only document that affects that is your proxy. Your power of attorney can't make decisions for you that way. That's not the point of the power of attorney. It's the proxy. And they can be, that's why they're often different people. And you can only name one at a time because they don't want arguments. You want a person that you really trust, and then you want to tell them what's important, right?
And you want to write it down with your medical provider and sign that, so it is a medical order that we have to carry out your wishes. Here in hospital, in transportation from a center to the hospital, that's the most important thing, I think. You can have the healthcare proxy, and that's absolutely important, but if you're making your own medical decisions, you want to have those outlines. So once you've decided on things that you may or may not want in certain circumstances, have the conversation with your provider, get that signature, your signature and the physician's signature, so we can...
And that's on the Morse form that you've heard about tonight.
Yes.
And that's the form that has kind of supplanted the DNR. Whenever I say most, they mean, you mean the DNR? Well, one of the lines in it is, don't resuscitate me if my heart stops. But then there are a whole bunch of other lines. Right. By the way, to me the most significant, I shouldn't say the most, one of the most significant lines in the Morse form is, don't hospitalize me. Now I know we're in the hospital, right? But for my clients, so I always talk about this kind of, my make-believe couple, Frank and Mary, and their kids, Peter, Paul, and Mary Jr., right? And I always tell people, if you get old enough to get the joke, you're old enough to be my client. But I tell them, their goal in life is they want to die and be buried in the backyard. Well, if you want to die and be buried in the backyard, you don't want to go to the hospital if you're on the floor, right? Because the hospital, in general, they're going to save you. They're going to save you. If they can't, I mean, and I get the fact, if you've got a Morse form and all these things, maybe not, but once you get to the hospital, so if you really want to die at home, you want to say, I want to die at home, which means don't take me to the hospital if I'm sick, right?
There is an option on that form that you can come to the hospital for comfort purposes.
Or for comfort.
So if you decide that you want to transition your care from active treatment to more comfort, quality of life, symptom management, you and your medical provider can elect only come to the hospital for comfort purposes. So ideally, things may be managed in your home setting with support. But say you fall, or say your pain escalates and you're not able to control those things, then that tells us as providers that your primary goal is comfort. And that's how we'll direct the care if you do come back to the hospital at that point.
An excellent point, yeah.
I want to just share one more thing. Number one, you mentioned the living will. The living will is actually helpful, even though it's not legally binding, because if you have a living will and if you went over with your healthcare proxy that living will, it often talks about what would you want if you were in a coma? What would you want if you were in a severe accident and you were physically incapacitated? It talks about those things and what you would want. And that helps to guide your healthcare proxy when you have a conversation and when they read through the living will, which sometimes is several pages, to understand a little bit better what your wishes would be. So it's always reasonable to do a living will, because that can be sort of a basis to have a deeper conversation with your healthcare proxy. The other thing I wanted to mention was many conversations have come up about the most form. So for me, right now, I would never do a most form. Why would I not do a most form right now? Because the most form is an order written by a physician that's active at the moment that you sign it. So if I did a most form right now and I checked off the box, do not resuscitate, do not intubate, it's not talking about what happens when I have a coma 10 years down the, or a stroke, 20 years, 30 years down the road. If I come into the hospital tomorrow with this most form and it's signed, do not resuscitate, do not intubate, it's active at that point in time, and all other healthcare providers will follow it. So it's something that is helpful and useful for when it's the right time to use it, to make a decision. Do not resuscitate, do not intubate, or other limiting things. But not everybody needs a most form done.
But everybody
Right.
can
But
benefit from a healthcare proxy.
Everybody needs a proxy, and it's always
Right.
important to talk about the stuff that's on a most form, so that when it is time for it, you're able to do it.
Well, I want to be sensitive to everybody's time because I know we've gone past 7:30.
8:09.
And we also have a raffle.